conversation about egg prices has come up. You've heard it. You've heard people talk about it, the culling of birds, bird flu, all of this. You've heard about this. And you realize that 150 million birds were culled by the Biden administration by edict. They said you have to get rid of these birds. Doesn't seem to be stopping the spread. And I wasn't terribly concerned about it, but I heard about some variants that have come up. One that has caused fatalities, which is concerning to me. So I decided to get a hold of my good friend, Dr. Peter McCullough. He is the Chief Scientific Officer at the Wellness Company. He joins me now. Doctor, thank you for being here. Look, H5N1 bird flu has been around for a number of years, but there's a new strain. It's deadlier, it's more dangerous, and I think maybe I should be concerned about it. What say you?
To explain, the original source is called the clade of the virus. So the clade is 23446. And the subvariant that was dominant for several years now, 2021 to 2024, was the B3.13. That caused the mild pink eye in the workers. That was essentially it. Then a teenager in British Columbia got very sick, went on the ventilator, ECMO, life support, survives. A man dies in Louisiana. A toddler and a man die in Cambodia. And there is the emergence of a variant D1.1 that looks like now the virus can attach to human receptors in the lungs, Steve, and it doesn't look good. The outbreak has gone on for far too long because of this counterproductive biosecurity measure of killing all the flocks of chickens and allowing fresh infection of a new flock. It's allowed too much time for genetic misadventure.
So please explain that. Basically, what you've just said to me is by culling 150 million birds that was directed by the Biden administration and then creating a new flocks of birds, it has rejuvenated the cycle of this virus. I think that's what you're telling me.
Right. The process that occurs is called genetic reassortment. The influenza viral strains can cohabitate with one another, and they can swap parts. If you let this go on too long, then actually a serious strain can develop. Now, the Coalition for Epidemic Preparedness and Intervention, CEPI Worldwide Center, has issued official alarms. Alarm bells are going off in every public health agency around the world. And I think what happened is bad policy has allowed this to happen.
So it is a bad policy. And here's what I'm confused about, Doctor. I hear those on that side of the aisle, Joe Biden's administration and the folks associated with it, follow the science. That's been their battle cry for years. Right, wrong, or indifferent, it was follow the science. Well, wouldn't they know that mass culling was a mistake and it would create this life cycle, if you will, for this virus to rejuvenate and to deviate and become more dangerous?
It was a mistake because the virus was carried by mallard ducks, wild ducks that keep reinfecting the farms. It's not like you can eradicate it in a farm and you're done. The important point here is that our public health agencies didn't follow the science on natural immunity. If the animals were just allowed to get natural immunity like they always have in the past, this thing would have been done 2 years ago.
So here we are cleaning up the mess of follow the science from politicians who don't understand the science at all. Now, in response, the Wellness Company, where you work, they have initiated a program to offer free medications to frontline farmers to protect against bird flu. Please explain what this is and how it works.
This is the Prevent and Protect program. Our farm workers can go to a website right now, get their own individually prescribed bird flu kit. They can start using a dilute iodine spray in the nose and the mouth before and after work. If they come down with symptoms, they can get a laboratory PCR test, at their doctor's office or emergency department, but start treatment immediately with oseltamivir, and if bacterial secondary infection, azithromycin. So we have our workers protected. All the serious cases so far in the deaths, Steve, none of them were using nasal sprays and gargles, and none of them got early treatment.
Yeah. Well, a vaccine for the bird flu, whether in humans or livestock, will work. Look, the apprehension about vaccines following what happened with COVID is very high. I would never do it. If you told me I should do it, I might consider it. But I think reluctance and avoidance of vaccines is at an all-time high here and globally, and for good reason. What do you say in that area?
There's a piece out in British Medical Journal saying vaccinating the birds and the poultry will make it worse. It's a disaster. The virus will become stronger and more resistant to vaccine immunity in humans. So far, the CSL Seqirus vaccine actually caused human death in normal volunteer trials. It looks dangerous, and even worse on the horizon is the Moderna messenger RNA bird flu human vaccine, or the CEPI self-replicating messenger RNA vaccines. Humans don't need bird flu vaccines. They simply need prevention measures, nasal sprays, throat sprays, gargles, and early treatment kits. The wellness company has stepped in the middle of this policy madness to bring a practical solution to America.
Let me ask you about something totally unrelated here just for a moment, Doctor. I saw this clip on social media, and I know you're pretty active on social media. You might have seen the same thing. It was about the measles. And I saw a clip from about 1969 on the Brady Bunch laughing about the one kid coming home from school. He had red spots, a little bit of a temperature. It's the only illness that you have that you don't actually feel sick, and you get to stay home and play games with your friends. Compared to NBC's Law and Order Special Victims Unit that had a kid with measles, and they were shutting down hospitals and this mass hysteria. Just the messaging about such things has changed dramatically, hasn't it?
It appears to be the same disease. A paper by Miller and colleagues, UK, from the entire UK registry, 1963. The rate of death before ICUs in modern care was 0.2 per 1,000.
Yeah.
Now we're told 2 deaths in the nationwide outbreak, and one of them confirmed, one of them not confirmed, but no information on what type of care they received. I am suspicious that these are cases that were undertreated and could have been saved.
There you go. If you want to know more about the Wellness Company and all the work that Dr. Peter McCullough does, go to twc.health/Gruber. You can get involved with their medications, their supplements. Everything's there for you. They're there to focus on your good health. twc.health/Gruber. You can save some money using that promo code as well. Dr. McCullough, it's always an education, sir. Thank you.
Thank you.
Really appreciate it.